Chapter 25, Poisoning and Overdose Emergencies. First, let's talk about the poisoning. What is a poison? A poison is any substance that can harm the body. So, I had a hazmat instructor tell me at one time that a difference between a good thing and a bad thing as far as poisoning would be the dose. So 1 or 2 aspirins is good for the body, 100 aspirins is bad. So it's all dose dependent. Uh, Water. It's also dependent on how you're exposed to it. If you drink water, it's just fine, but if you inhale water, it could become a poison. So it all depends on the dose and the route of administration. So common poisons we run into: medications, petroleum products, gasoline, diesel, cosmetics, uh, pesticides, plants, foods. Pretty much anything out there could be a poison for us. The effects of the poisons depend on the concentration. How bad is it? Routes of entry. Did it get on the skin? Did it get injected? Did you inhale it directly into the lung tissue? The patient's age, weight, health. Lots of factors come into play. A person has a history of lung disease and they inhale a poison, they have a lot harder time getting rid of that poison. If they inject the poison and they have liver damage, now they've got other issues because the liver's not capable of getting rid of that. You could have superficial damage from the tissue damage if it has contact with the skin and has some type of burning impact, like a bleach or a Drano. It can cause suffocation, like carbon monoxide. It gets in there and prevents your body from uptaking oxygen and causes a suffocation process. It all depends on how it gets into your body, how it's going to damage the different body systems. The way it gets into your body, ingested or you get it into your digestive system, inhaled going into the breathing, absorbed through the skin, or injected directly into the body. What we really like to do is, as EMS providers, make sure our own houses are in order. Make sure we have all our poisons put up where nobody can get to them. Even if you don't have kids at home, if you have any friends that bring kids over, make sure your poisons are put up. The most common place people store their poisons and cleaning fluids, directly underneath the sink. Easy access, right at kid level, and sometimes the things don't look what they really are. How do you tell the difference between pine sol and apple juice when you're a 2-year-old? The other thing we want to do is take this good information and get out in the community and try to prevent these poisonings. Most of the people that get poisoned are kids, and we really don't want to have kids getting hurt and coming into our system. So do all you can to do community education, get that out there. So we've got poisonings like sprays and cleaning fluids going in through the lungs, drugs getting injected into your body, ingestion. People, for some reason, drink rat poison and drain cleaner, usually intentionally. Household cleaners can actually absorb through the skin, and so can insecticides and different types of fertilizer. Organophosphate is a fertilizer that gets absorbed through the skin. Very dangerous. Ingested poisoning, like I said, the apple juice and the pine sol look very similar, and kids may accidentally eat or drink the wrong thing. Adults still have accidents. Sometimes they pick up the wrong cup and drink the wrong thing, but a lot of times you've got to do some history taking and try to dig deep and get some understanding of what's going on in their life and see if maybe it was a deliberate process. There's a book that you can get off of Amazon called The Final Exit. It is a book geared towards geriatric patients on how to identify which meds they may be prescribed, how to stockpile those meds until you have enough to cause a dose that would be lethal. So it's basically a how to kill yourself book. Plus there's plenty of opportunities online to find that information. So there's just plenty of resources out there that are fighting against us, and we want to get these people before they get to that point, or if they do it, so we can reverse whatever happened to them. When you're trying to figure out what happened, try to find out what the substance was. Get the exact spelling. Get pictures of it if possible. The worst thing you want to do is bring it to the hospital. If you want to see a hospital clear out quick, walk in with a container of methyl instant death, sit it down on the nurse's station, and say Merry Christmas and turn around and walk away. That will clear the ER, they will be shut down, and you will probably be looking for a job somewhere else shortly after that. Find out what kind of what time frame we're talking about with your patient. How long ago did they get exposed to the poison? How did they get exposed? Did it go in the digestive system? It takes a little time to get processed through the digestive system, but if they inhaled it, it's a lot quicker. So that's very important information. How were they exposed? How long were they exposed? What route they were exposed? As much as you can. How many pills are missing? If I look at the bottle, it was filled yesterday, and they're missing 50 pills already. That gives me a clue they may have taken all 50. Maybe it was the first time of their medication, and now they're having a reaction. It could be an allergic reaction or a poisoning. Maybe they got the wrong meds. So ask a lot of questions and do your due diligence to try to figure out what's going on. Did they do anything before you got there? Did they try any home remedies? Did they try syrup Epicac? Did they make them drink a gallon of milk? Sometimes the treatment's on the label. Sometimes it's on the safety data sheet, the SDS. And they will try things before you get there. There's one employee here in town that has hydrofluoric acid as part of their processing. They have antidotes on site, and they're trained to give that to each other if they get exposed to this poison. So that may be something you run across. They've already given the calcium chlorate, I believe, is the medication they give. Estimate their weight. Try to figure out the age of the patient and their weight, because both of them are going to come into play for us. What kind of effects have they had? Have they nausea and vomiting? If they vomited, what did they vomit? What's their current mental status? Do they have any abdominal pains, diarrhea, chemical burns around the mouth? When they drink the acid or the alkali substance, sometimes it burns the mouth, so you'll see that. You'll find the odors around their mouth. Food poisoning happens when you don't have good care, good safety, hygiene when you're preparing food. A lot of times this is a community food event where multiple people are bringing food from different locations, and it's not quite prepared to health standards. They may have nausea, vomiting, abdominal cramps, diarrhea, fever. It's usually not a sudden onset, so it's not a one that you can tie back to it, but as much information as you can get, that's going to help the health department zero in on, are there other potential victims, and can we find a source of where the problem occurred. Activated charcoal. It works through adsorption. This is why you find charcoal in your fish tanks. It absorbs or adsorbs the toxins that are in the fish tank. Just so you know, it doesn't change what the medication did or whatever's in the stomach. It just keeps it from being absorbed into the body, so it prevents any further damage. Many poisons, but not all, are absorbed by activated charcoal. In our system, you need to call for medical control anytime you want to give activated charcoal. You need to have the patient's age, their weight, what they ingested, how long ago they ingested, and your ETA to the hospital. Typically, if you're less than 20 minutes, they will not give you orders. If you're more than 20 minutes, they're going to ask you to give it. So you need to be very truthful with the medical control, make sure they have all the information they need to help you with that decision. Contraindications for charcoal. The patient can't swallow. You can't get them to put it in their stomach if they can't swallow it themselves. They have an altered mental status, which would lead to not able to maintain their own airway. We don't want them drinking something that has a potential side effect of vomiting if they can't maintain their own airway. Then the other thing is you don't want them to have ingested alkalis, acids, or gasoline. All these things will burn on the way out, and we know a really common side effect of activated charcoal is vomiting, and we don't want to induce this stuff coming back out a second time. We used to use syrup of ipecac to try to induce vomiting. The problem is most overdoses or poisonings cause altered mental status, and when we give the ipecac, we can't control the airway as good. So we need to just use the activated charcoal. Dilution is another way that poison control may ask the person to address the poisoning before we get there. Have them drink water or milk. That will help soothe the stomach, slow the absorption, and then sometimes poison control will say that's all that's necessary. If they are on the phone with poison control, you want to talk to poison control and get their information. Make sure you're getting accurate information and the patient's understanding everything, and that they have a system in place to take care of them if you do leave them there. Patient care, detect and treat the life threats, the ABCs. Do a good, full, thorough secondary assessments, looking at everything to make sure there's nothing else wrong because they probably have an altered mental status. Get your baselines, call medical direction or poison control or both. Sometimes we will conference call medical direction and poison control. Poison control does have physicians on staff, so they can give you orders. They may not be consistent with your orders or your standing operating procedures, so you may want to have your physician on the call with you just to make sure. Make sure you take the substance information. Pictures are great. Don't take the dangerous stuff with you to the hospital. Antidotes. We very rarely use antidotes. The one that we have access to in EMS is naloxone. It is Narcan. It's the one that is a anti-opioid. If you work in a fire department with a hazmat team, they will have advanced hazmat life support medics. They're called tox medics. They do have more antidotes available, but that would be through your hazmat training only. It's not an EMS level training process. Acetaminophen poison or Tylenol. For some reason, people love to take this to overdose. Tylenol PM because it's got the sleeping effect to it. The problem is it takes forever to kill them. It's a slow, painful death, but it's not anything that's reversible. 4 to 12 hours, you get the loss of appetite, nausea, vomiting, because it starts to shut down your digestive system. In 1 to 2 days, it starts to shut down your liver. You start having liver pain, jaundice. If you give the antidote within the first 12 hours, you do have some recovery, but the long-term damage is there. So I've seen several people with liver acetaminophen overdoses that end up either needing liver transplants or having long-term chronic issues. Ask questions, ask what they overdosed on, do some detective work, look around the medicine cabinets, garbage cans for empty bottles, take care of your ABCs, and get them to the hospital. Most of the time, most of our overdoses, if we're outside of charcoal or Narcan, we don't have a lot of treatments other than managing the life threats. So for basic ingested poisonings, you're asking lots of information. Lady looks like she's pretty calm, but she may have overdosed accidentally. They've got a really neat device on the market now it automatically doses your pills so much per day. So you load up all your meds in hoppers and you press a button and it gives you your AM meds all in a little cup. It's kind of like the hospital does. Once you figure out what they may have taken, let the hospital know so they can prepare for it and give you some direction if needed. If they do ask you to give activated charcoal, it is charcoal mixed up in a sweet tasting laxative, so it's going to taste crappy and it's going to look worse. So what you want to do is put it in a cup like this that has a lid, and hopefully you can find a straw that's not clear so they can't see the black stuff going into their mouth. They need to drink as much as they can. It's usually 1 gram per kilogram, but I've rarely got more than 25 grams or 1 bottle into a person before they start chucking it out or refuse to take any more. But get as much as you can. And be prepared to catch the vomit. Use vomit bags like this, the little kidney-shaped vomit tray that they have in the hospital. That is mainly used for redirecting vomit towards your partner because it doesn't contain anything. It's hard to seal up. These are the vomit bags like they have in the airplanes, and once you go in them, the vomit doesn't come out. This is something you do want to take to the hospital. Take the vomit with you. They like to look at the vomit stuff. Common inhaled poison. Most common, carbon monoxide. I also have chlorine gas, ammonia. The combination of the two are bad. Working around any type of chemicals or pesticides. And then carbon dioxide is also, you see that at restaurants and convenience stores, they've got carbon dioxide alarms because they have large tanks in the back for their soda fountains. And if they have a leak, it could actually displace all the oxygen in the building and cause a little bit of problem with you breathing. With our inhaled poisons, scene safety is priority because whatever's in the air that caused the problem for them to inhale can still be there in the air for you to inhale. You only enter if you've been properly trained. If you have self-contained breathing apparatuses or SCBAs and all the protective gear, you should be able to safely go in. If you are not trained to use that gear, do not try to train yourself at the time of. Usually with CO overdoses, intentional overdoses, we end up with 3 patients. The patient that was trying to kill themselves and the 2 cops that ran in to try to be heroes. They usually most of the time they get the patient out, but they do inhale enough that they end up needing some type of treatment. So if you're not trained in hazmat, you're not equipped for hazmat, do not enter the scene. Find out what was involved. When did it happen? How long did it happen? Did anybody do anything? Did anybody ventilate the area after the fact? And then what symptoms were they experiencing? Carbon monoxide is a colorless, odorless, tasteless gas from incomplete combustion. So it's around wood burning stoves, furnaces, generators, people cooking in their garages or inside during disasters. A lot of times during natural disasters or cold winter storms, we have a few carbon dioxide poisonings with people trying to heat their houses with improper heating devices. Signs and symptoms, mainly flu-like symptoms, but there's no history of flu. The problem you're going to run into that kind of differentiates it is that severe headache and the cyanosis. So they're going to have dizziness, breathing difficulty, nausea, altered mental status. The cyanosis is something that you don't see in flu-like symptoms usually. Special monitors are used to detect it. The fire department carries these monitors, and in our local community, the utility company carries the monitors, and they will respond to any carbon monoxide poisoning. So you've got double response just to make sure everybody's safe. Treatment, get them out, get them into a clean air, give them 100% oxygen, and take them to the hospital. You really want to go to a hospital that has a hyperbaric chamber. The only one in our area that has that right now is Memorial Central. So you want to try to get the patient to that hospital because they're going to dive them down a couple of atmospheres. That's going to help them release the carbon monoxide off the red blood cells and get it out of the body. Do not get the patient. Don't go in and get the patient unless you're trained. You can't hold your breath long enough. Detect and treat life threats, ABCs, secondary, oxygen, and transport. Get them to the hospital. Smoke inhalation. With smoke, you're going to have a couple of different problems going on. The air is hot, which is going to burn the lung tissue and the airway tissue, which is a problem. Then the chemicals in the air are going to be poisonous. Because of all of the plastics and other things we're finding in homes now, smoke inhalation patients are going to have the potential for cyanide poisoning, which is a very serious problem. So we want to figure out how long they were exposed to the air, what they were exposed to, if there was anything special in the house. Maybe there was a meth lab. That's something the fire department will pick up on pretty quick and help you out with. But you need to get that person to the hospital as quick as possible. They're going to have difficulty breathing, coffee, smoky chemical odor to the breath. When you look at them, their nose is kind of singed. The hair is singed around it. They've got soot, or they're coughing up sooty sputum. All signs they've had hot air in their nose and their mouth. Treatment, make sure they're safe. ABCs, maintain the airway. Be very cautious on the airway. Because it's damaged from the heat, it has a high potential of swelling. So we need to get them to the hospital as quick as possible. Lots of oxygen and rapid transport. Here's one of the suicide options that's available online. It's called the Detergent Suicide. You can pick up 2 easily obtained chemicals from Home Depot or Lowe's, mix them together based on the formula you get from the internet. It produces hydrogen sulfide gas, which kills you in a matter of minutes. The cool thing about the way they market this detergent suicide is they also ask the person nicely who's going to kill themselves to print off 2 signs, one for each side of the car, that says, "First responders, be cautious. This car is filled with hydrogen sulfide gas, and it's dangerous if you open the door." So they'll sit in their car, put the signs on the doors, mix their chemicals, and say goodbye to life. And when you get there, do not open the door. That's going to release the hydrogen sulfide gas on you, and you'll become a secondary victim. Wait till the fire department's there with the personal protective gear, maybe even the hazmat team, because usually this is pretty fatal. There's only been 1 documented cases of a survival, and that was actually here in El Paso County, but the guy that saved him was a trained hazmat responder and had hazmat equipment in his truck with him. So they managed to get him out before it was too late. Biggest thing with any poisoning or suicide is safety. So you don't want to get exposed to these fumes. Like I said, there's the warning notes, and let hazmat in there. Let them take care of it. Things that absorb through the skin are bad. Now, the other problem we have is you as a first responder getting it on your skin. So this is again, we want to make sure we have our PPE on, maybe long sleeve shirts or a jacket, something to protect your skin, definitely gloves, and then you need to decontaminate the patient before you treat them. Water is the ultimate decontamination tool, and you want to soak them down, wash them, then soak them down again, take their clothes off, wash them again, and then you can put them in your ambulance. If you do transport a patient that was not decontaminated, you become contaminated, and so does your ambulance. So your ambulance is out of service until they can get it decontaminated, and then you will go through the decon process once you get to the hospital. At Memorial Central, the shower heads on the hazmat decon showers are 18 inches apart, and there's only 1 shower. There's 4 shower heads, so you can take a crew of 4 in there, but there's only 1 shower. And because we want to keep the pores as closed as we can, we use cold water only. So you get a group of 4 people from a fire engine in there taking a shower with 18 inches apart from the shower heads. You're standing side to side, trying not to drop your soap, because whoever bends over, it's going to be a dangerous situation. Patient assessment, look for vitals, look for your life threats. Brush off the powder first and then irrigate with water. We want to brush it off first because a lot of these are chemical react or water reactive. They'll have an exothermic reaction. So you brush everything off, every powder gets off the skin with brushing with a gloved hand or a brush or something. And then we want to flush with water for 20 minutes. It's going to be nice cold water, 20 minutes, and then you transport. Do not think you're going to wash in the ambulance because you have no water source. Try to bring as much information as you can, the labels, the SDSs. Do not bring the toxic chemical to the hospital. Injected problems or poisons, illicit drugs, usually with the needle. Then we also have injections from snakes, insects. When I worked at Butterball, we had occasionally an injection of a butter into a hand. If you didn't move your hand quick enough when you were injecting the Butterball turkeys, now you had a butter hand. Poison control. Call it if you need it. Excellent resource. It's the poison control in Colorado is located at Anschutz Medical Center. They have two MDs on staff and then a whole system of call takers. They've got the supercomputers that if you tell them they took 4 different drugs, they can put them together and formulate a response and possible reaction symptoms based on those 4 drugs. So they've got really good systems in place. So let's talk about alcohol and substance abuse, a big volume of our calls. Many patients have conditions that are directly or indirectly related to it. Most of your urban outdoorsman population have some type of alcohol or substance abuse background. But don't think that just because of a person's social or economical background that they do or do not have drug or alcohol abuse issues. Some of the more wealthy schools here in our community have a real big problem with black tar heroin. Some of our other schools have problems with marijuana, crack. So it just kind of depends on where you are, what your drug of choice is, but it spans all over the place. Alcohol abuse, probably the most common thing you're going to run into. It's a central nervous system depressant. We have people that are chronic professional alcoholics. They handle quite a bit, and then they have issues after a while of long-term exposure to alcohol, like chronic cirrhosis of the liver, or just poor coordination and doing things that aren't smart. So you have the acute poisons. Treat the patients with the same respect and dignity as all others. You do not know for sure it's alcohol, so we want to make sure that we rule out any other medical conditions that might be going on. They might be taking other drugs too, or somebody mixed another drug in the alcohol. So be careful. Look for possible combinations. Some alcoholics are irrational and aggressive, so use precautions. Maybe even use law enforcement if you think. It's all a judgment call there. Patient assessment. Like I said, rule out the other causes too. Alcohol is only one of many things that can cause altered mental status. So the AEIOU tips, alcohol is one of them, but there's a lot more options. They could have a combination going. The alcoholic that's having a diabetic emergency. If they're intoxicated, they cannot give you a good foundation to do a focus assessment, so you're going to have to do a full body assessment, full secondary assessment on these. Signs and symptoms of alcohol. Alcohol odor or breathing on breath or on clothing. You smell the alcohol. Swaying or unsteady feet, slurred rambling speech, flushed complaining of being warm, nausea, vomiting, poor coordination, slow reaction time, poor judgment. Things look better than you thought. Does this sound like diabetic emergencies? Does it sound like poisoning? Does it sound like all kinds of other things? So be careful. Ask a lot of questions. They may have blurred vision, confusion, hallucinations, lack of memory, altered mental status. So it can do a number on your central nervous system. So this is an area where we're going to be very cautious on what we do and how we treat these patients, because they may not know they have other medical conditions that are causing more of a problem than the alcohol is. The other thing we run into is alcohol withdrawal. If they quit drinking and they've been chronic abusers of alcohol, they can have delirium tremens or DTs, uh, tremors, hallucinations, seizures. Actually, apnea is a one thing that can happen. We had a guy that was a professional drinker. He was a part of the Alcohol of Fame. He was the highest I ever saw him was 0.63, and he was talking to me incoherent at 0.63. We picked him up one night. He was not breathing. I intubated him, got him brought back to breathing. We got to the hospital. Blood alcohol was 0. He had been so dry that he couldn't function without the alcohol in his system. So we actually got a alcohol IV from the pharmacy, and they gave that to him in the ER. So they brought him back up to a level of intoxication and then tried to bring him back down. Uh, Withdrawal, you're going to have confusion, restlessness, unusual behavior, hallucinations, seeing pink elephants, tremors of the hand, seizures, hypertension, tachycardia. Another problem with drinking alcohol is the vomiting. They puke everywhere all the time. If you have a patient who is intoxicated and vomiting, or any patient vomiting, take the red biohazard bag, cut a slit in it for the head to go through, and then just drape it around their head. And now they've got a 20-gallon bag that they can vomit in. Makes it much easier to control. Because they can't give you a good history, you're going to have to do the full trauma assessment and keep an eye on what could be going on with. Monitor vital signs, treat for shock, protect them from themselves. Sometimes they do stupid stuff. They could have seizures and get to a medical care facility. This is one of those that we go all over the place on how to treat. There is a detox option here in Colorado Springs. If you can find no medical reason to take your patient to the hospital, that may be an option. Go with your local protocols. But just because they're intoxicated doesn't mean they have a medical condition going on. So we're going to work at that and try to figure out how to keep them out of the system if we can. Other substance abuse, any chemical taken for anything other than therapeutic. Opioids, uppers, downer, hallucinogens, volatile chemicals are the main categories we're going to talk about. So opioids, these are your codeine, oxycodone, Percocet, uh, morphine. Those are the big ones out there. They're used to relieve pain or cause a state of relaxation. Heroin's also on there. So if my job or my intended use is to relieve pain and cause a state of relaxation, if I find a patient that's relaxed, they did an overdose. If I find a patient that has reduced pulse and depth of breathing, they're way too relaxed. I got to bring them back. But we've been overdosing on Narcan for a long time here because we think that just because they're relaxed means they overdosed on it. That's the intended dose. That's what should happen. Pinpoint pupils, relaxed muscle, profuse sweating, sleepy coma. If they are not breathing, that's a medical emergency. If they're having difficulty maintaining their airway, that's a medical emergency. Just because they're relaxed and chilling doesn't mean you need to bring them back to reality. Uppers, stimulants for the upper nervous system. Cocaine, meth, snorted, smoked, or injected. Signs of uppers. They're super excited. That's the guy that's awake for 3 or 4 days in a row and won't stop talking. They just keep working and working and working. Um, Dry mouth, dilated pupils, sweating, no sleep for a long time. A friend of mine was addicted to meth, and I think 6 days was the longest he went without sleep. So that's a long period that they have total focus. It's not good focus, but at least they're awake. Downers are your central nervous depressants. These are your benzodiazepines or Benadryl, roofies, GHB, uh, date rape drugs, things that make you drowsy, sluggish, poor coordination, poor decision making, and makes you pass out. Hallucinogens, LSD, PCP, ecstasy. State of intense excitement is distorted perception. You see things, you hear things, your pulse is rapid, pupils dilated, face flushed. In the 60s, they actually experimented with LSD and PCP as a drug to help people concentrate in the military. And then it turned out there was many abuses to it, so that it's no longer used. But it's all dose dependent, like you said. Volatile chemicals. This is why you have to show ID to buy spray paint at Walmart. The vapors that are produced are inhaled. You get a rush as they hit the central nervous system. You daze, loss of coordination, loss of contact with reality. Because you're inhaling it through the nose and mouth, you got swollen membranes, funny numb feeling, tingling inside the head. Totally jacks with your heart rhythm. Put it in the bag, you huff it in. One of the most common things I've seen people use is a sock. And then the choice of colors of paint, the silver and the gold, metallic gold paints have the most volatile chemicals because it's bigger particles, and so they use a stronger propellant. So you'll see a guy with a gold face where he's held the sock up, and that's what he's been doing is breathing in those chemicals. What you want to do is figure out what they were exposed to. Uh, Maybe they've got a mix going on. Most people don't buy their drugs they overdose on from a reputable pharmacy. They buy them from the guy down in the corner in Acacia Park. So you never know the quality you're getting or the strength you're getting until you take it. So start asking any questions you can. Try to figure out what they took and how they took it. Maybe where they got it from. Remind them you're not law enforcement. You're just there to help. Uh, Drug withdrawal. Uh, it's very similar to the DTs that you'd see from alcohol. Shaking, anxiety, confusion, irritability, hallucinations, sweaty, increased pulse and breathing rate. Their body has become addicted, and you're taking away what the body needs to function. So they're going to have some serious symptoms. Get a good assessment, maintain ABCs. If they have overdosed on anything narcotic, any opioids, give them Narcan to fix their breathing. Keep the patient calm. Be careful on your own. Look for evidence of injections, track marks. Uh, Look for evidence like paraphernalia. Remember, you're not law enforcement, so all you're doing is identifying things that can help you support the idea that the patient was abusing drugs. It's what the track marks are going to look like. They use up every vein on the body. If you need to start an IV on a patient with IV needle use, ask them where the best vein is, because they have them mapped out and they know where the next one is they can use. As always, if you have any questions, write them down, bring them to class. Let's have a lively discussion. Thanks and have a great night.